Hello everyone, today we'll be talking about a condition called cystic fibrosis. Cystic fibrosis is an inherited disorder which causes damage to the lungs, digestive system, etc. There are cells which produce mucus, sweat and digestive juices. We'll refer to this as secretions. In normal conditions the secretions are thin and slippery, but they sticky and thick in cystic fibrosis. Instead of acting as lubricants, these secretions plug up tubes, ducts, and passageways, especially in the lungs and pancreas. Now we look at the symptoms, but before that, signs and symptoms vary depending on the severity of the disease and also the development of life. Also, people who are firstly diagnosed in adulthood have milder and atypical symptoms, including recurring bouts of an inflamed pancreas, infertility, and recurring pneumonia. Firstly, we'll look at respiratory symptoms, and they are persistent coughing that may produce thick mucus, wheezing, recurrent sinusitis, low exercise tolerance, inflamed nasal passages or a stuffy nose, etc. Now we move to digestive symptoms, and they are foul-smelling greasy stool, poor weight and growth, intestinal blockage, particularly in newborn, chronic or severe constipation which may lead to rectal prolapse, which is when the rectum protrudes outside the anus. Cystic fibrosis occurs through a defective gene. This means children need to inherit one copy of the gene from each parent in order to have the disease. If the child inherit one copy of the gene, they won't develop cystic fibrosis, but they will be carriers and may pass it on. Now we look at a few complications that may occur through cystic fibrosis, and they are pneumothorax, coughing out blood, intestinal obstruction, diabetes, infertility especially in men. Alright folks, that's all we have for you today. See you in the next video.